Today, whether Ozempic can affect your mood, and what the surprising alcohol research shows. A patient on Ozempic comes to clinic frustrated. I've lost 15 pounds, but I just feel flat. Could the drug be affecting their mood, not just their appetite? This isn't obscure. Semaglutide, Ozempic, Wegovy has been prescribed to millions, and as its use has grown, so have reports of psychiatric effects. Here's why it matters. GLP-1 receptors are expressed in brain regions controlling emotion, the prefrontal cortex, hippocampus, hypothalamus. These drugs cross the blood-brain barrier. So the question is, does this drug work here too? 3 mechanisms under study. First, they reduce systemic inflammation. IL-6 and TNF-alpha are linked to depression. Second, they increase BDNF, supporting synaptic plasticity. Third, they modulate GABA and dopamine. These aren't just metabolic effects, they're brain effects. 2024 systematic review of 81 studies found GLP-1 agonists may reduce depressive symptoms and suicidal ideation. But a 2025 Vigi-based pharmacovigilance study, over 2 million reports, found semaglutide associated with significantly higher reporting odds for depressed mood, an adjusted reporting odds ratio of 1.70, for suicidality 1.45, for anxiety 1.26. These are real-world signals, not trial data, suggesting some patients worsen. In July 2023, the EMA initiated a safety review for suicidal thoughts and self-harm with GLP-1 agonists. A published case illustrates the pattern. A 54-year-old woman with depression history started semaglutide. 4 weeks later, irritability, anxiety, insomnia, anhedonia. Symptoms resolved after stopping. Onset within weeks. Resolution after stopping. This temporal pattern is consistent. Animal models show a bidirectional pattern. Anxiety peaks early, then improves with chronic use. Timing matters. Early mood changes may be transient or a warning sign. There's also an eating disorder signal, a ROR of 4.17 to 6.80 across GLP-1 drugs. Likely weight loss related, but clinicians should ask in patients with eating disorder history. Now for something that surprised researchers. A Swedish nationwide cohort, over 227,000 AUD patients, found semaglutide users had 36% lower rates of alcohol-related hospitalization, an adjusted hazard ratio of 0.64. For liraglutide, 0.72, comparable to approved AUD medications. The effect extended to other substance use disorders. A randomized clinical trial in JAMA Psychiatry 2025 provided prospective confirmation. Low-dose semaglutide, 0.25 to 0.5 milligrams weekly, reduced laboratory alcohol self-administration. Craving reduced by 39%. Grams consumed reduced by 48%. Modest trial size, but direction matches the observational data. Not an approved indication, but the signal is real. The AUD story may be just the beginning. A 2024 IUPHAR review found GLP-1 agonists reduce substance use across multiple classes, opioids, nicotine, stimulants. A pilot RCT found exenatide plus nicotine patch improved smoking cessation. An OOD trial is registered on clinicaltrials.gov. The mechanism: reward pathway modulation, reducing dopaminergic reinforcement that drives addictive behaviors. Clinical guidance. First, take a psychiatric history before starting. Vulnerable patients need monitoring. Second, monitor mood at every visit, especially during dose escalation. Third, watch for onset in the first 4 to 8 weeks. Fourth, consider discontinuation if mood worsens significantly. Data suggest reversibility. Fifth, consult or refer when in doubt. This area is still being defined. Here's the bottom line. GLP-1 agonists like semaglutide are among the most prescribed drugs in America. They can affect mood for better and worse. The mechanisms are real. The signals exist. But there's also an emerging story. These same drugs may reduce alcohol cravings and help other substance use disorders, off-label and under active study. For a subset of patients, monitoring matters. As use expands, understanding their psychiatric and addiction profile is becoming essential. Questions about today's content or topics you'd like to see covered in future episodes? Drop them in the comments below. And if you found this clinically useful, hit subscribe. More psychopharmacology breakdowns are coming. This video is for educational purposes only and is not a substitute for clinical judgment.